TBI is really a huge problem in this country. There are literally millions of people who suffer from TBI a year. And I think it has not really been recognized so much until relatively recently. So I think in the past, when people had concussions or mild TBIs, I think the thought was, oh, it's no big deal, I just got my bell rung, I just got knocked around. But we know now that concussions are brain injuries, and it's important to get them evaluated. In the brain, really, it's all about real estate. It's really about where in the brain the damage is. And depending on where that damage is, there are different symptoms that come out. So, for example, in people who may have frontal lobe damage, so the front part of the brain, that part of the brain is really important for things such as our personality, cognition, attention, things like that. And so we treat those symptoms accordingly. Oftentimes, some of the most sensitive signs of TBI are processing speed difficulties. So people may have difficulty processing information like they used to. They also tend to have trouble multitasking. So before, they might have been able to do multiple things at one time, or at least tried to, but now after a brain injury, after a TBI, they may have a lot of trouble doing that. But there are lots of other symptoms that people can get after TBI. They can have mood changes, their personality can change, they can be more agitated or aggressive, and they can have trouble with their attention and memory. Unfortunately, there's no medicine that can reverse traumatic brain injury, but we do have medicines that can work for the symptoms that are a consequence of traumatic brain injury. And so there are mood stabilizers that we can use, there are antidepressants, anti-anxiety agents, and some specific agents that we don't typically use in general psychiatry that we can use for traumatic brain injury as well. And then besides medications, there are actually rehabilitation techniques that may be helpful with traumatic brain injury, and there are actually brain training programs that are also now available, which can be helpful. I'm Dr. Vaishnavi with Carolina Partners in Mental Health Care, and I want you to be well.